Today is a very busy day for newly qualified medics in England as they step onto the wards as junior doctors for the first time.
But with hospital waiting lists increasing and anger growing over the latest pay deal, it's a pretty difficult time, isn't it, to be joining the NHS? We've got Dr. Emma Runswick from the BMA, the British Medical Association, with us. And you've been a junior doctor for a while now, for 3 years. Just tell us what it's like for people who are starting today. Do you remember your first week?
Yeah, of course. And when you're starting, it's a whole mixture of emotions. There's a lot of excitement. So this is the culmination of years of work for newly graduating medical students, whether you've come straight from school or whether you're a graduate entry. So there's lots of excitement to have, but there's also lots of nerves, taking additional responsibility. And then there's the added pressures of entering the NHS at a time like this, when waiting lists are very high, when pressures are so terrible, particularly in A&E, when wards are understaffed, and when we know that burnout is rising. We've got 44% of junior doctors in the last GMC training survey saying that they are exhausted at the thought of another working day. So it's really difficult to join the NHS at this time.
And traditionally, people would join at this time because it might be a little quieter. They might get a bit more help, maybe someone to guide them through their first few days. It is anything but quiet right now, as you've touched on already.
Yeah, so all of the newly starting medics will have had a little bit of time on the wards in the last couple of days. The last week or so they will have shadowed, but that doesn't mean it's any easier to step up. We're coming down off the end of the last COVID wave, and we've got waiting times in A&E really significant. We've got permanent winter now in the NHS through decades of understaffing and underfunding, so it's not the easiest.
And in your role as Deputy Chair of the BMA, you've written, or the BMA has written to Liz Truss and to Rishi Sunak, stating what it is that you're seeing on the front line. Just tell us what you've said and what it is that you guys want.
Yeah, so we've got a real workforce crisis in the NHS, and that's for a whole number of reasons and a whole number of factors. We've got lack of people coming in at the bottom. We've also got a crisis in retention, particularly for senior doctors who are affected by pensions taxation. And that's on top of the repeated pay cuts that we've been facing. So a whole series of actions are needed to retain people and recruit people into the NHS so that we can staff appropriately and give patients the best care that they need.
And sorry, just very quickly, pay cuts, actually, you mean pay cuts in real terms, because you did actually have a pay deal in 2019.
So it's 2% a year for junior doctors, which this year is going to amount to approximately a 10% pay cut. So a whole month for free, or the equivalent of you losing all of your annual leave. So it's a significant pay cut, especially for junior doctors. For senior doctors, 6.5% pay cut in real terms. For GPs, because it's not funded, because the pay rises for other staff are not funded, it'll be an even more significant pay cut.
If anyone's going out to start their first day today, what were your top tips? What was the thing that you could have really done with knowing when you won your first week?
I think it's about remembering that you're human.
Right.
So you have to advocate for your own, basic needs, like having your lunch, having a drink, having a rest, turning your brain off and on.
Yeah.
Because when you do that for yourself and for your colleagues, you not only look after yourself, but you also provide better care for patients.
Is there a danger that, because it's your first day, you're keen, you're excited, you're kind of ambitious, that you forget all of those things?
Yeah, and also because it's so busy.
Right.
Yeah. It's very, very difficult to prioritise yourself and your colleagues when the needs of patients are so high. And when you're understaffed, it can be very, very difficult. Not everybody recognises that you have to put yourself first.
Yeah, I mean, it's a challenging job at the best of times. I was just looking at some of the figures around pay and stuff. The starting salary is 29,000, isn't it? Which is under the average, the median salary for full-time workers in the UK. And of course comes with a lot of stress, the job. I mean, how do you think doctors are feeling about, the cost of living and the pay deal that they currently have, and whether or not they might do anything about it? I mean, do you think we might see strikes or not? I don't know.
So we might well do. The starting salary is £14.13 an hour, and lots of people are quite shocked by that. The additional kind of top-ups come from additional hours. So we work 48 hours is our full-time, which is obviously more than 37.5 or 40 as most people. So we work 48 hours, nights and weekends and so on. So there are top-ups from that. But it puts people in a very difficult position. Like everybody, energy prices are going up, rent is going up. We have additional costs from student debt. We have additional costs from GMC, college fees, and so on. So the situation is getting pretty dire, particularly for those who are the most junior or who are less than full time. And that's one of the reasons, one of many reasons, why the BMA is committed to balloting if we don't have a commitment for pay restoration. So there might well be action in the future, but the government's still got opportunities to change course.
And as you said, there could well be action. And also that retention issue that you've talked about just gets worse, doesn't it? Because if you're facing those cost pressures, the private sector suddenly becomes way more attractive, doesn't it? Regardless of how much you might want to help out in the NHS. If you can actually make a better salary in the private sector, that might be more attractive.
Or abroad. So lots of people going to Australia and New Zealand where salaries are higher and working conditions are better.
Right.
So people are moving out both retirement entirely, so leaving the profession, and some people are moving out into industry, some people are moving abroad. And as I said, particularly that's a problem at the higher end of.
And is that an experience issue as well, losing people? Because we're talking today, aren't we, about new doctors starting, you know, they're keen, they're newly trained, but they just don't have that experience yet, because that takes time to build. And if you're losing that at the other end, that causes huge problems, doesn't it?
Absolutely, and we're losing trainers.
Okay.
So, you know, trainees require training, so you need senior doctors to provide that for them. And in the GMC training survey, we found that significant numbers of trainers are not getting the time that they need to provide training to juniors. So there's a question about fulfilment in work that is undermined quite substantially by existing in this morally dubious circumstances where we're not providing the care that we want. You're not providing the training that you would like to for your junior colleagues. You're facing pay cuts. You're facing pension taxation charges. So lots of people are stopping at the top of their salaries.
A really important day, isn't it? And let's hope that it goes smoothly for everyone. As we said, normally would be traditionally quite quiet now, but it's just not, is it? So Emma, thank you for running us through all of that. Dr. Emma Runswick there, Junior Doctor, Deputy Chair of the BMA Council. Thank you.
Thank you.